Hey everybody, today's video is a very important one. It is about sudden infant death syndrome, or SIDS, which is a very sad topic, but I hope this will be an encouragement to you that it's extremely rare. We'll talk about that, and just a quick review of modifiable risk factors. So you may remember in the 1990s, the American Academy of Pediatrics had a Back to Sleep campaign. Because of that campaign, the incidence of SIDS in the United States decreased by 50%, which is awesome. So the current rate is about 35 per 100,000 live births. And if you do the math, that's only 0.035%. That's tiny, less than half of 1%. So that's really encouraging that this is very rare, but there were still 3,500 deaths in 2018, so obviously people do worry about this. So I want to talk with you about some myths about SIDS, and some truth, some evidence-based truth about SIDS. So first of all, the sleeping environment is absolutely critical. Your baby should always be placed on its back, not belly or side, on a firm mattress with just one thin, well-fitted sheet. It should not have blankets and stuffed animals and lambs, sheep's wool beneath it and all this stuff. No water beds, no couches, no recliners, absolutely not. Just an approved and safe cot or crib. If you've ever looked at the antique cribs, which are beautiful, be very careful. The slats should never be so far apart that you could fit a can of soda between them, because then that could be a head entrapment risk. So make sure it's a new crib, or at least that it meets the safety criteria. And now let's talk about when SIDS actually happens. It is by definition an unexplained death, because the babies do have an autopsy and a death scene investigation. Has to be unexplained with no reasons found on autopsy. It is by definition under 12 months of age. But remember, 90% of cases are under 6 months of age. So the highest risk are between 2 and 4 months, slightly higher risk in males than females, higher risk in the winter months, higher risk with babies who were premature or very low birth weight, or with certain brain abnormalities. So things that you can modify risks: follow the directions, place the baby on its back to sleep, keep your room temperature cool. Babies do not need a hot room environment. A lot of parents or grandparents often think that the baby needs 3 extra layers of swaddling and blankets and it needs to be 80 degrees in the house. Absolutely not. False. In fact, terribly false. The room temperature should actually be cool, and that's safer, around 68, 70 at the most. And running a fan in the room, either by temperature modification or by just stirring the air, has been demonstrated in studies to decrease the risk of SIDS. That's awesome. The use of a pacifier has been shown to decrease the risk of SIDS. Of course, wait to introduce the pacifier until after breastfeeding is well established. It's possible the pacifier helps just by altering the oropharyngeal positioning of the airway. Maybe it's just practical, like it's hard to sleep on your face with a pacifier in your mouth. Who knows, but it's been shown to decrease the risk. Breastfeeding is hugely protective and decreases risk by 50%. Now, the reason that winter months may have slightly more cases is because often in winter months we see more babies with colds and upper respiratory infections, and that too is a risk factor. The American Academy of Pediatrics recommends that you keep your baby just beside your bed, but in your bedroom, for up to 12 months, the first 12 months of life, or at least until the first 6 months, but we recommend the full 12 months. It has been shown to decrease the risk of SIDS because perhaps you're more in tune to the baby's needs, or you can hear it if there's a problem and you respond quicker. It also makes more convenient breastfeeding if the baby's just beside of you. Now remember, we do not recommend co-sleeping, particularly for these first 12 months of life. Co-sleeping can lead to accidental suffocation, accidental rollover injuries of the parent's body over the baby. The baby could fall off the bed. The baby could become suffocated in a pillow or a sheet or adult bedding. The surface may not be firm enough. The bedding could get bunched up. There are so many reasons that we do not recommend it. Extra, extra, extra caution, please, as well. If you are rocking the baby and could fall asleep and drop it. If you are snuggling the baby on the couch and fall asleep and it falls between the cushions, so many tragic stories of this happening. Just be extra careful. If you are extremely tired, place the baby in the crib or the bassinet. Don't snuggle it, and then you fall asleep and a tragedy occurs. There are also some myths around SIDS. One of them is that vaccines cause SIDS. That's been disproven over and over and over and just not true. One of them is that if you use a monitoring system, you can prevent SIDS, and that's not been proven. So we do not officially recommend a monitoring system to prevent SIDS, just doing all these things we're talking about. And then another thing that people worry about so much is that if their baby's a spitty baby or has reflux, that if they place the baby on its back to sleep, it will throw up and accidentally choke itself and even kill itself. And that's just not the case. Healthy babies seem able to turn their head and process that spit up without actually leading to a tragedy. So it is important to place your baby on its back to sleep. One easy mnemonic is ABC. The baby should always be alone, placed on its back in the crib. So I hope this information has been helpful so you can modify every risk factor possible and not excessively worry because it is so rare. One more thing I forgot to add that's super important is that the exposure to tobacco smoke greatly increases the baby's risk of SIDS. Even maternal exposure, if the mom smokes during pregnancy, that's a risk factor. A lack of prenatal care during pregnancy, very young maternal age during pregnancy are all risk factors. So do not let anyone smoke around your baby. Do not let it ever be in an environment with secondhand tobacco smoke. If a family member wants to hold your baby and they've been smoking, they should take a shower and change clothes before they expose the baby to that secondhand tobacco smoke because it's extremely dangerous and it's been demonstrated over and over to increase their risk for SIDS.